Hello and welcome to this webinar on public health administration. It's great to see all of these familiar faces. I'm Jeanbaptiste, a graduate from San Diego State University with my bachelor's and master's degree in public health. And I'm currently working in Health and Human Services in the Office of Minority Health. And today we are given the opportunity to learn more about health disparities within the African American community. So let's start off with a few basic questions. What is considered the standard historical overview of health disparities and the relevance to the African American community in the past? The history of health disparities in America goes back to when the United States was founded. According to the book Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare, racial and ethnic prejudices and oppression were embedded in the central documents of the new republic. The relevance this has to the African American community in the past is that they did not have, and still currently don't have, the resources to get medical treatment, whether it's because they couldn't afford it financially or they just didn't have reliable physicians. As mentioned in the scholarly journal on structural vulnerability, cultural competency was critiqued in 1970 for using cookie-cutter stereotypes to treat certain ethnicities and completely disregarding the socioeconomic and biological factors. Health disparities have accounted for higher infant mortality, premature death rates, and an overall lower quality of healthcare when compared to the national average. As stated in the American Journal for Public Health, an African American baby is 2.5 times more likely to die before their first birthday when compared to his or her white counterpart. It was also reported that in 2000, 83,500 African Americans had died from preventable causes. This means that if disparities had been eliminated within the past century, nearly 84,000 African Americans could have survived their medical conditions. Our next question is, what has my research revealed about today's approach to health disparities and the Black community? A major approach to eliminating disparities among minorities includes health promotion, disease prevention, and early detection. Promoting health essentially means educating the community and encouraging citizens to choose healthy behaviors and make changes that reduce the risk of developing chronic diseases. Such risks can include unhealthy eating habits, a lack of physical activity, and smoking tobacco. And this also ties into the idea of disease prevention. Another key approach that's necessary for eliminating disparities is moving towards universal access to healthcare and allowing the funds so that they have that option to a healthier food source. So our final question for today is, what is needed to further our understanding of the complexities of health disparities and its impact on the future of the African American community? Well, in order to further our understanding of the complexities of health disparities, one must acknowledge the extent to which race is associated with social economic status. According to the Public Health Journal, Race, Socioeconomic Status, and Health, they show that because residential segregation, brought on by mainly the 1950s, it had led racial groups in the U.S. to live in a distinct neighborhood environment. Furthermore, social conditions at the neighborhood and community level contribute an important factor in racial differences in health. African Americans have levels of poverty that are 2 to 3 times higher than those of whites. This means that poverty-stricken communities don't have as easy of access to a safe space for physical activity. They don't have the access or the funds for a healthier, more organic food source, and they also don't receive the same quality of medical care compared to middle and higher class neighborhoods. The impact this has on the future of the African American community is significant due to the decrease that's already seen in life expectancy and overall health, which could lighten and lead to an even more overwhelming number of preventable deaths. To conclude, I would like to remind you all that our Q&A session is a monthly event, but unfortunately, this is all the time I have to speak to you all today. Be sure you tune in for our next segment coming up after this message. Thank you.